You are watching Liberty Online TV.
This is Liberty Online TV powered by Orange Sierra Leone.
Orange.
Wise men bank with UBA.
Wise women too with UBA.
School pupils in Sierra Leone, do you have a creative writing skills? Would you love to win a brand new laptop and a scholarship grant worth up to 50,000 new leones? Then, this is your moment. The UBA Foundation, with support from UBA Sierra Leone, in collaboration with the Ministry of Basic and Senior Secondary School Education, is proudly launching the 5th edition of the 2025-2026 UBA National Essay Competition, as the UBA Sierra Leone has teamed up with the Institute for Legal Research and Advocacy for Justice, ILRAJ, to make it bigger and better. Are you a senior secondary school pupil anywhere in Sierra Leone? Then get ready to showcase your ideas. Write a handwritten essay of not more than 500 words on the topic gender-based violence in schools, causes, consequences, and solutions. And yes, the rewards are exciting. First prize, a brand new laptop plus a 50,000 new leones scholarship grant. Second prize, 30,000 new leones. And third prize, 20,000 new leones. Remember, your essay must be handwritten, not typed. Upon submission, please include your full name, passport photograph, your age, town and district, school name, and of course, the name and phone number of your parent, guardian, or teacher. Submit your essay at any UBA branch, MBSSE Regional Office nationwide, or the ILRAJ office, or send us a scanned copy to cfc-sierra-leone@ubagroup.com. For more information, please call us on 078 200 200 or 099 22 11 22. Deadline for submission, April 30th, 2026. So, sharpen your pen, share your ideas, and be the voice for change. Visual impaired students are also encouraged to apply. The UBA Foundation National Essay Competition, unlocking young talent and shaping the leaders of tomorrow. Write it, submit it, win it.
Good morning, viewers, and welcome to a brand new week and the very first edition of the Breakfast Show, where they come to you live from Liberty Online TV, where they stream on Facebook, YouTube, and also now a website where they powered by Orange Sierra Leone. Where they bring this edition come to you this Monday morning. My name is Khadija Bangura.
And Mina Mabel Kaba, good morning. Today is Monday, the 13th day of April 2026. Inside this edition of the Breakfast Show this Monday morning, we can look at the health sector. As you all know, the last time we will be look at this sector now the same way the junior doctors then been get an ultimatum. Most of them be say they want to stay because them get concerns them. Well, we see of late different things don't they happen under the health sector. We make today we want for focus on day for no waiting and waiting now the latest updates on the health sector, as we see the CT scan, the ultrasounds, solar power installation where they go in different hospitals, and also the bonds units where they don't open in a Connaught hospital. We're going to look at all of them developments and the way they happen at the health sector, and also discuss what's in the future holds for the health sector. And also now this edition of the Breakfast Show also we're going to talk to Dr. Richard Conte later on, where they can tell we concerns them where he gets as he don't write a letter to the Speaker Speaker of Parliament for sake of one bill where they before Parliament, we now the National Security and Central Intelligence Act. Well, we go for locality concerns them where Dr. Richard Conteh gets and wait to make a write letter to the Speaker of Parliament. You go also known at this edition of the Breakfast Show.
As you can remember, the last time on that particular bill, they will be host the chairman for the Legislative Committee in a Parliament when Honorable Abdul Malik Conteh we been talk about waiting the bill they bought, and after where the Chief Minister Dr. David Moini Nasenge don't go table this particular bill in a Parliament. Well, one of the people that get concerned now, one of the flag bearer aspirant them for the All People's Congress APC party, Dr. Richard Conteh, will be make be right an open letter to the Speaker of Parliament who says stating concern them we get for do with this bill. Well, now the next segment of the Breakfast Show we can talk to him, but firstly we can talk to Dr. Mustafa Kabah, we now the Deputy CMO, now the Minister of Health. We don't see so many things recently they go on at the Ministry of Health. They don't get different facility, they upgrades and they happen at the Ministry of Health and not of return no more. Even at the upline parts them, the Ministry of Health don't they do so much. So this morning when they come start the Breakfast Show for engage them for know exactly who side and the place Sierra Leone health sector now. People can remember before now, so many concerns don't they come up, especially we compare different facility them. Some man been get for fly go to other country, then forget well body. But small changes them don't they happen. And that Dr. Kabah, they can explain this morning. Good morning, Doc.
Good morning. Thanks for having me here.
All right. Like I don't tell with viewers them before now. You say go agree say challenge in a salon health sector. We don't they see also challenge then they for even get a CT scan, for even get proper medical facility, for even get electricity in the hospitals.
Exactly.
That be a challenge. But quite recently we see the spotlight on the Ministry of Health. Waiting really don't change.
Well, first of all, thank you for having me and good morning, viewers. We did see this improvement where it take place now the Ministry of Health because of the leadership and the direction we'll get for improved health services for the people of this country. What we see, we did follow we 4 key pillars for improved health sector performance. First of all, you see we did expand and you bring in the quality in the primary health care, so that at least people then they get services close to them in their communities, right? Where the primary health care not sufficient for providing services where they need if it become specialized or become complicated, the secondary systems then for able for support. Now you see the secondary systems then would they bring in things like CT scans, would they bring in more diagnostic capabilities, open up the labs, get solar solutions, you know, all over the country, get oxygen plants. If then they also not work between them two, then they get forget a good referral network between the primary and the secondary. If somebody they need an ambulance, the ambulance for day, if we pick come on time, you go left and outside for go left hand. Then waiting at the most important thing apart from this all health security also. We therefore be ready in times of outbreaks, in times of pandemics, so that at least with services then they continue for provide. Why would they continue for provide with services whilst would they able to handle and tackle the outbreak, right? So now the concept that they would use for improved healthcare, especially in our country. And if you see what's in happen, we not just to try for say we improve, but we use indicators them for monitor the progress we make. Sierra Leone don't register one of the fastest drop in maternal mortality. We know one of the indicators that we use for check with health system. 70% reduction in maternal mortality don't take place over this past decade, and due to the actions they already take, we didn't try to make sure so we even get them below that point they was out there right now. So if you look, currently we get a system, we get a campaign we don't roll out, where His Excellency the President say in Addis Ababa on the 14th of February that no woman of die where they go born picking now facility them. So that means we get 300 days of campaign where they really go out there, we make sure we will do everything possible for prevent anybody from dying. Picking under 5, you know, then pick it away they go now hospital. Then say not for die. 14 they will prevent now hospital. The one they we don't born, then forget immaculate. So now that campaign need to go on. For me, you do all these three. A lot of things then get for come in place. You get to make sure you get the right infrastructure. You get to make sure the health workers then ready for do the work. You get to make sure the supplies and commodities then can at the hospital. You get to make sure they continuously the monitor and supervise and the upgrade the work the way they go na the facility. So all this one at this like when I see last week we go na the health worker then, His Excellency the President, he go hand over 10 new buses for them people then. At least if you go work now, you know for Sidon Pakeke or Okada, they go and get injury, we go also lead to some problems. Or you go late for work. So inside these 300 days, a lot of things then get for be rolled out. One I don't just see as people of this country and not for improve the quality of services that we provide for people in this country.
Doc, in terms of placing priorities, how now they decide whose side they get waiting? Because even though we see improvements and they happen, not just in Freetown, but also concerns they come from other parts of the country. Just last week, somebody sent me a video from Banff where it disclosed a facility where very poor currently. So how now they decide whose side they get waiting?
Well, first of all, we get over 1,600 such facilities in this country, scattered all over the primary healthcare level. They get over 50 so hospitals in this country. And a system will be don't go down for a long time. You get to take time for make you put everything to speed and get equal standards all over. So what we are doing is to go out there and really make sure, say, in catchment areas, population, we get large catchment areas, we try to step up their own facilities them so that they can go to take care of the people that way they're close to them. Each and every Sierra Leonean forget about 5 kilometer distance to a health facility. That would assure. Waiting now they try to bring quality into the health facilities there. So some of the way they're in bad shape, a lot of renovation then they go on at this country. We don't renovate close to 100, 150. Primary healthcare level facilities. We build new ones. We get up close to 300 of them. We don't get solar solutions. Then get good wash facilities. I mean, hand sanitation facilities that they are existing in these facilities. So it's work in progress. We're not going to say you go now the whole country, no sign of the way go see issues. But anyone we come up like this one, we don't come up. So definitely actions are being taken currently for make sure so make fix them properly.
It don't reach to a time that this country you say people and see a video of a pregnant woman where they try for locate a health facility where they get for put in a hammock. And this all are some of the things that will be exposed the health sector say a day in bad light. In terms of access to the health facility, also you go say the country they now.
I think so they do fairly well. I mean some of that video they now I think like Falaba or so now. Some place like that they be happen. We really make sure so step up. We've tried to find out what can happen, and we locate ambulances so that this kind of thing not gonna ever happen. Even though the terrain so rough, some of them places and they for access. So get ambulances located all over this country now, and for pregnant women it's free of cost. And where the ambulance take you, it go left in at the nearest health facility where you handle the kind of condition we get, right? So, like I be saying no more, in terms of access, 5 kilometer radius from each Sierra Leonean, you forget access to a health facility. We challenge what you see in some of these health facilities that they not get the quality of services where they're supposed to provide. For make people they utilize the services, but then they so now the quality of services then now we try for improve. We train the staff, we bring in equipment, we give them electric solutions, we give them sanitation facilities, we supply them with drugs and commodities. Then we network them now with other facilities that if something happen at the level we don't able to manage, then we're able to refer on time. Now wait till it's don't go bad before you begin sending on to the next facility. So I think access is there. What we are trying to improve on is the quality.
Talking about the access and the quality, the health sector now one way the most recent audit report expose a whole lot of things them where they happen at the health sector in terms of putting together proper management, because when I can go all out for the access day, but if proper management or the mismanagement and corruption go always be a stumbling block between the access and the quality on the try for give.
No, you're right. One of the things that were key in hospitals, in the primary healthcare units, even at the ministry level, you need leadership. You need good, dedicated, people that are focused for lead with health institutions. So over the years, people were trusted into positions without giving them the skills and the tools so they do their job, with the technical capability. So what to do as a government and as a Ministry of Health is that we identify this as a big problem. So we don't get a link with University of Global Health Equity in Rwanda. We're in a big university, one has FSABI, and then they do very well for making them train with the hospital leaders them. So about 4 weeks ago, we get a big meeting at Freetown. Outside the team come from Rwanda. We choose all the medical heads, the medical superintendents from the hospitals, the matrons and the hospital secretaries, and bring them together for make we train them back. We train them on human resource management, community engagement, basic administration, conflict resolution, health financing. So different components. So the course, they go for 9 months. After this one, so we don't do the first intensive phase when at the beginning. Now then they continue 9 months online with the tutors them online. Then they do classes every day, and inside this 9 months, key indicators then do what they try for check for make sure we see improvement in them. So this is the kind of things what they do. So every hospital forget the right leadership, not only the doctor, the nurses, the secretaries, the administrators, and anybody they manage the facility, then for they up to speed for move with health institutions. We know if we will do that, we will see the change we required. You see hospitals them or institutions that will get the right leadership in this country, how then they do. So
with the present upgrade we don't happen recently in the healthcare doc, you go proudly say no Sierra Leone no need for sick medical attention outside again?
Well, I know we'll say 100%, but we don't reduce and drastically if Sierra Leoneans and outside go forget the healthcare. Because the issue is that some people are not even aware that if I get this condition, Nayanda will go, Nayanda they will go now. We don't get a lot of specialists now in this country. People that win a master sabi people them for manage sickness them. They train more. We get about 150 doctors where they go through specialist training in this country currently in different fields, in surgery, internal medicine, gynecology, pediatrics, and obstetrics and gyne. Where they want they don't, then they add per the number we don't get. But for train the person, now one, you also can forget the equipment we then need. Now we don't bring in like the CT scan, we see we launch. The CT scan will get a Connaught now. Now the best in the country. Now 128 slides, meaning a fast, less exposure, the quality of the film, high standard. Even in the sub-region of West Africa.
But we didn't think in the electricity come to mind,
Yeah,
Dr. Kabana. I country with the struggle with electricity. Then they don't come where all are during the public be need for step up and get a generator.
No, I think we don't get over that now. Now I make one of the key things that we do for health institutions, then we bring in solar solutions. Because the national grid can always supply the light we need. So they look for alternative means. We get a generator then they run them on fuel, and these are thermal machines. But we also don't bring in renewable energy solutions when our solar. Like Connaught get 1.2 megawatt solar installation. PCMH all are doing combined and get close to 500 kilowatt solution. So that thing will be to get tried away, see light, no, they know they happen at them place then again. And apart from the solar solutions, we bring in batteries like where light day, the battery then they charge. If light go off and the machine they on, that battery they pick up and keep that machine, especially the oxygen machine, the monitors, so that at least you get some maintaining energy situations. We don't get about 300 of our facilities. They don't get solar solutions, including hospitals and primary health care. Go Bo, UDC, go Kenima, UDC, go McKinney, go all over the country. Even right now, Kono, the Maternal Center of Excellence, we don't build. We build for them a 500 kilowatt solar installation. So all over the country, we know the energy very important for sustain and maintain the life. We bring in this renewable form of energy solutions for support we service delivery.
I'm missing updates in the way they give in the health sector. People still the way this issue of trust. You go see you go in a private hospital. Now we own government doctor and go did it. People go believe them prefer for going to them private hospital, and left facilities when our government operated facilities them. So around the issue of trust, waiting the ministry they do for build this trust back, let the public know say facility we they get na public hospital, because now most times now then we local doctors and get it. Then can get them kind of facility. Because if you take Connaught, for example, if you ask person who say prefer private hospital or Connaught, then go prefer still go to private hospital. How na they build the trust between the public and on a service provider in the hospital then?
Well, trust na two sides. You know, we dey do best for make we improve on the services. We improve on the services, we dey try for invite the public for use the service. If I tell you say no more come, you know, yourself no they just can almost. So when you come, you forget the experience. Well, I don't promise you. Not to so. If I say where you can now, you go meet good doctor. If I meet good doctor. If I say we can now the equipment and the equipment for there and for work and for come to the right diagnosis. So the more people can get this kind of good experiences when they get contact with the facilities, the better the perception. It's not only about telling, you know, everybody.
But also the one that in governance, are they using these facilities? We don't see minister they sick, you go to hospital, you meet minister, you meet you parastatal head, you meet directors, they use that facility because now one thing that way people always they say then they encourage we for good, but when they're sick and then picking and sick, then prefer for fly them abroad. When they use the system?
Of course, we do use the system. We get like Connaught Hospital, you get a specialist outpatient unit where now private place, you can come, it doesn't matter your status, you meet the specialist and they each one get in consulting room. We don't renovate a very nice place. It is below the stroke unit. So get high-end people then they go there quietly, then they receive service. They are being treated. Some of them prefer, of course, to go somewhere else. And you know the push person. But anybody who forget that kind of service now public hospital, especially Connaught, you are welcome.
Nothing saying that the trust we don't lacking over the years make many people prefer for use the private hospitals because the private hospital mostly can get the proper equipment, especially when it come for the scan and do other testing.
Well, now the trust was not there after a while. I mean, the health sector in Sierra Leone was challenged by several things before. Let's come from Ebola, you know, the war and everything. So you're building it again. And we'll not be even get the specialists, we'll not be get the right people, we'll not be get the infrastructures that already put together now. But now we are coming with them. It therefore take some time. You know, na relationship. It just happened overnight. But when they build them together, and wait to know more what they say is that the communities and the people in this country, when I can't test with services, when I can't use it, and yourself we can, if you get good experience, share them with the people. And wait till they say, we services are very reasonable and it cater for the entire population. The prices are so low. Even the CT scan, hold on launch and the ultrasound devices, our prices will be very, very low and minimal and affordable for the public.
Dr. Kaba, what are major public concern the diagnosis? A lot of people believe say wrong diagnosis they happen and most of them can lead to sudden death. And when you look at the death rates in the country, it's quite alarming.
Well, the diagnostic capability now they enhance them. Like if we see we go buy machine them, we're highly sophisticated, put on our public sector hospital. Now for enhance the capacity of we doctors and for make the right diagnosis. Like what is able the CT scan, na state of the art machine. It will able help we for diagnose a lot of things and save a lot of lives. Sometimes the people then they die because of several other reasons, not to just the way on side, but the attitude, the health-seeking behavior also of Sierra Leoneans. Them, I want make yourself also pay more attention to health. If something they happen to you, know, wait till last minute you go. If you go self last minute, no matter where you go, much not will happen for you. Make sure so we do regular follow-up, we do regular checks. You know, the one that we get hypertension, diabetes, then they are controlled. We do exercise, we do things in moderation. So preventive aspect is also important in which we do now. More try for prevent the sick force from reach the bar. But if you reach the point now, we say within the health sector for ready for take care of you. We not get everything it, but we do best for make sure say we come up with the right diagnosis where required. And we don't get the equipment, you need to get a trained person. We understand how to use the equipment or for interpret the result. If I get lab now, I go to lab test. That people don't come up. Somebody for interpreter, somebody for tell me say, now so they by this test, and now so treatment you require. And then people then they get different level of specialization. Now they will be trained so now, if now a specialist, they look at that result, they look at from a different lens than somebody way not to a specialist. So now the training then now they go on for make get the high end people then for the diagnosed people then better and get the right treatment.
For me, when I get the high end people, it shows say gap then still there. And in as much as they invest a lot in getting sophisticated machines, when I need to get the right people, we be able for use the machines there. What in the ministry they do for close some of them gap there, because we don't hear many time doctors are threatening for strike and they complain about their conditions. The welfare, it seems like nobody not care about them.
Yeah, we did bridge that gap by ensuring that, you bring first of all the right skill set we required. Like if me say me a surgeon, I forget the skill set where a surgeon required, not only for Sierra Leone standard, but internationally. So now the skill set that would train you to the point that if you're able to diagnose well, if you treat surgical conditions, then very well. Then the skill set will be backed with the attitude, right? Compassionate, patient-centered care. We now would also try for work on with colleagues and so that we get. But we don't get the person, you get for retain them. There are retention plans. For example, you make sure, say, you do continuous medical education, then you get them promotions on time. People then they get sort of amenities that we then supposed to forget, like the doctors which they're entitled for get made and get up. Then the career path is clear for everyone for no say. Now so they grow. After 3 years, now so I go day after 4. So you are motivating them to stay. So all of this is going on. And I mean, in a system like this, once in a while you must get people that we feel not too happy with waiting they go on. But a good man and come up, we address them. Like that talk with the talks to the doctors and be aggrieved. All the issues that we then come, would address them. Yeah.
But the need for reach to that point before una address the issues, because them coming out threatening say with the lay down tools, not a new thing.
Yeah. No, they're not needful. But in negotiations like this, they wait for make it reach to the point where the action will be taken. But if the person express intention for doing, I will discuss so that when I not get to the point for may lead to that kind of actions and put in place mechanisms for them particular issues and they may then arise again. So Nadando we don't put in place some systems where at least some of these things we then ask for could be addressed. And what's also important, not the Ministry of Health departments no more. Most of the concerns we got other ministries, departments, and agencies that they work with. So all go for collaborate so that we think that will really happen or happen.
You talk about attitude, and one big thing where plenty people not only get good experience when they can access public health facilities and what are the systems within in place for one monitor or maybe a complaint channel, say perhaps, especially Bele woman them, now the most times can get challenged when they can complain about the attitude of on our workforce within some of the government hospitals. Which channel day where they monitor them and also how the patients them for feel protected enough, say I get complaint against certain healthcare provider as safe for go later complain anything like that kind of system there.
Yeah, well, we get different approach them. First of all, if there is a gross malpractice, we get the Medical and Dental Council, we for intervene and try for make sure so find out the truth and actions are taken. We get the usual supervision, the way they go on at different levels in the hospitals. Then, what we don't also do is that we don't set up a complaint line. There's a line where the Directorate of Hospital and Ambulance Services, they share a number. I think you even get them on WhatsApp. If you get any complaint, you can call that number there. Then people on the line always will try for address. You don't need for say name. Because I mean, my binti, I go na PCMH, somebody go do me so, and the person in details than this, they'll go follow up. What I think usually happen is that when you go out there now, you tell the patient, do ya help me man older than this person will do this. They need to talk. And I know, now the issue that. So how do we break it? So we put now some points in our CCTV cameras, now some hospitals, at least for the monitor key performance, service delivery points, so that if anything they happen, we go capture them. We try to also for the go out unannounced, so that we go to check what's in the go on now we facilitate them.
In terms of healthcare advancements and technology, how you go describe Usai Salon Day?
Well, I think we don't go high up. We don't go to a point where, at least, if you get some particular diseases, we manage them. We not only work with the public sector, but also get strong collaboration with some private sector institutions there. We use for training, we use for diagnose. So like, we even don't set up a neurosurgical unit. Now, Connaught Hospital, if person get issues within brain and spinal cord, we get a unit now in Connaught Hospital where they look at. And the CT scan definitely enhance the diagnostic capability of that unit, right? We get cardiologists, people that already do the heart disease, then in this country. We get people that we now bone doctor them. Then safety, then they do their work. We got other people that gastroenterologists, but body they watch the guts, the intestine. Now like how they talk, so we set up a whole endoscopy unit. Now Connaught for the first time. Like if you get something wrong with you, let them decide they get ulcer, all the time. Then we go there and put the camera, watch inside your belly, see if not really ulcer, then take specimen. Or then one day we can get cancer of the intestine. Then go from behind, watch and take a probe and send them. So all of them things need to happen in the health sector at the moment.
So is it safe for say most of them diagnosis where people can travel go like Ghana, for example, not in a way perhaps then go to Connaught Hospital, for example, able do one day?
Exactly. Most of them now we can able do them. And of course, you get high-end things that you get for build a system. Like if you want to bring the most sophisticated devices, you get for training. Like right now, they need our mind with the process, but you need to just jump out there no more.
So salon.
You get for the train the people them. We get for work with them. You get for renovate the space. You get for make sure say where it come. You get a sustainability plan around them so that not to the machine no more you put there. I don't count now and so what. If you come, you're ready, you prepare the place, you get the staff there with you run. Like I don't do for the CT scan. The CT scan, we took almost a 1 year process for get it here. For train, equip the place, renovate the place, get a sustainability plan, and we don't even get residents and our people that already train for become radiologists in this country. We get 4 of them. Now Connaught Hospital. So in the next 3 years, we add on the number of specialists them we'll get now this country on radiology.
So, Dr. Kaba, is it safe for, say, when it comes to CT scan, Sierra Leone health sector right now, they compete with countries like Ghana?
Of course. The CT scan will get a cannot. I mean, if you find an Ghana center, a very high-end hospital, not any small hospital get them. And we make sure, say, the one will buy it customized to a country. We go to General Electric na USA, you know them, na reputable company, GE. We say we want our CT scan. We're not going to pick on a shop. We say we want a CT. They said, okay, let's do an assessment. They did an assessment of our country, our temperature, the humidity, the electrical challenges, and then build them for we. So not to the one within the bill for Nigeria. This one for Salon specifically, then build up. And then build the one that cannot, they don't build, then build the one back.
All right, welcome back. We still get Dr. Mustafa Kaba, the Deputy CMO from the Ministry of Health. This morning, it give an overview on the different upgrade that we done they happen na the Ministry of Health. Well, you don't hear from Dr. Kaba. If you know a Sierra Leonean, we normally we something up with you. You not get confidence in the health sector. You dey buy tickets, fly go overseas. Dr. Kaba they are shown this morning say with waiting and get right now, especially in a hospital like Connaught, they're not Sierra Leonean not afraid. Get confident.
you know, it's I notice say Sierra Leoneans not like that's where connect say governments. As soon as you say government, hospital government, this government, that it difficult for a belief say it's really working. So is it an assurance coming from you this morning? Say Connaught, for example, before we been get the shots lights outrage there, you better talk about contesting. Sierra Leone get facility to contest with Ghana, for example, like the CT scan. Is it an assurance you give the public say when they go Connaught Hospital facility them where they can go for then they get them currently?
Exactly.
Up and running.
And the thing is, what we talk about a privileged few way go able get the ability for go Ghana. What about the one that will not get the opportunity? You understand? Then they boko na this country. And what they say is that we on work now will take care of everybody. Yeah. The way we not able to for they see how they support them. And then facility then they right now will get now this country. Then they at a level where the kind of reports themselves what they get from them, you compare out on any country. And like the CT scan, we not only a standalone machine for we salon, we connect this machine and all the arrangements around now with Columbia University in the USA. Columbia University, una known a renowned university. Now they help we with ICAP for all this procurement, train the staff, and now we get an agreement with Columbia University. Like for say, we don't done this film. Some of the reports then they report them for we. For give some quality assurance, for make sure say we people then they up to speed for the get the right reporting. So we get all of that for people them, and make people then no worry. If you can now cannot look like what's happening. You now don't see the bombs unit. You remember the tell we get the Wellington fire incident in this country. No hospital now we get bombs unit. But 3 years down the line, the government and the ministry we don't develop, and we partner in Leon Oil and Leon NP. We don't develop a bonds unit when a 50-bed facility. If you get any fire incident now, you skin damage, then they're able to take care of it.
Then we look at one big challenge in salon winner maintenance culture. Because over the years, you go get people, they can say, oh, governments don't get this through private sector support or how the case might be, but for sustain them particular facilities and over the years, don't they be challenge? You go along the line, 1-2 months, you go for access the facility and then say they down. Waiting at the thing where they in place for sustain the improvements and we they talk about on the health sector.
Yeah, that is very key because machine and technology, you get spare parts, you get engine, and like Mutkana, you get for the make sure say somebody they will sabi for fix them, and for the do preventive maintenance, for make sure say troubleshooting issues are also addressed. What we do is that we get biomedical engineers, we then train, and General Electric will get a warranty for 2 years with the machine for all maintenance. If anything happen and the flying people then can work with them. Then whilst then they do this, then they build the local capacity also of we teams. We also get a framework arrangement around the operations of these machines. It's not only we not only left to a public sector arrangement. We get a private-public partnership arrangement where AMI has been recruited for run the operations of 2 machines, Freetown and Kenema. And the operations of these machines include the staff, they include the biomedical engineering, the machining upkeep, and the general sustainability approach towards it. There will also be a governance board where the ministry and civil society people then get for day, credible Sierra Leoneans and get for day, so that in the watch waiting they go on around this machine. Because like I say, no more anything like this, you get for make sure so you get a sustainability approach.
Dr. Kabara, this is a very important question we maybe ask, because let's take you back to the days of the Ebola. The Ebola exposed Sierra Leone health sector because then in the ambulance safe na be a challenge. The country invests so much in ambulance facility where Yusuf been at the ministry by then. Recent audit report they show say the country not even get up to 100 ambulance there at this point. We should say maintenance culture na big challenge. Investments can go into some of the equipment there, but we're not able for maintain them, for keep them.
Well, now the approach, I mean, something that will happen before we, of course, government and continuity, we all know be some arrangements in the way for don't in place for we. Like how is tell you no more now. The CT scan they don't bring. There's an arrangement. There's a sustainability plan for 5 years for those machines, right? Looking at the maintenance, the operations, the upkeep, the routine checks. There is a plan. But if you bring them, you not get this kind of plan, you're doomed to fail. The first CT scan will be kind of discount. It did not work for 1 year. It's 2 slides, a very old one. It's not this kind of system. It did not work because there was not a proper plan. The ambulances now, you say talk say the ambulance system, it don't improve. They like I be they trading.
When it begin improve?
It don't improve for the past 1 year. The uptake, the
that now after the latest audit report?
Yeah. After. And I don't know if we'll be host the CEO now. It could don't give us some updates about the figures, because they say improvement. If you look at the data, the amount of calls that way they come, the amount of missions that way they complete, the locations of the vehicles, the response time, how fast you get the service. And if you call, how fast they will can see you and pick you up and take you to the nearest place. So for getting fleet of ambulances and they from Ebulana vehicle. Vehicles then get for undergo wear and tear. After a while, you need a new fleet. So what do they do now? Constantly, we try to buy like small, we add on to the fleet when the funds are available. And with time, we'll get more ambulances. But we own issues that it's not only about the ambulance itself, now the service. The ambulance is a service. And not only they come with the vehicle, if we come with the trained personnel, if we get the equipment on board, and if we're able to respond to the issue. So now the service, we are looking at not only the number of vehicles.
With the recent equipment they are don't invest in and don't come with the public hospitals, where normally they can say government hospitals. This money you see they even compete with country that will get good health facility like Ghana. How about the private hospitals where most people can run to? And then private hospital there, now the doctors them now they run them back as well.
Well, you see, the health sector in Sierra Leone is not only reliant on the public sector, and even other countries. Private sector into health is very, very key. So we as a ministry, we collaborate with private sector institutions and we provide services. Since they will not get now in our public sector, if they're in the private sector, we can still use them as Sierra Leoneans and make sure, we save one day we'll get in our public sector. But if it ain't the country, we're not going to say, no, we're not use them. Or you're not good, no. We make sure, we go, we check. If it's worthwhile, we use the MRI. The only side we don't get MRI now, Choitram and I think ECOMED, will not get it in the public. But they try to get one. So if me need now the MRI, they cannot, right? I don't do the CT scan, but something don't come now when I need the MRI, I can still use the service. We jointly make sure, with Dande and this one, we get the right diagnosis for 3-2 people. So we also encourage private sector for boost up. Some of them think they will not get, may them come with them, may them say get another facilities there for the sake of we Sierra Leonean people and may them get good services.
For the purpose of accountability, you will find this morning, let the public understand the mode at which you are able to acquire the CT scan, especially the ordinary corners, because for the bonds unit, we understand, say, now in partnership with NP, we to the call to charity things the way it can do, but where it come for the CT scan, now 100% funded by the government of Sierra Leone? Yes.
Now, the government of Sierra Leone fund them. Of course, His Excellency the President get some partners them where he put this issue to, and I then say, okay, more help you. Then GAM, but then put them through the government for making use of them.
Under the public-private partnership?
No, inside the government, it come as funds for the government, for make the government use them for procurement. Also for the partners, they made the bank out, but we put it inside the system so that the government get the capacity for procure. And where these funds come, like I tell you no more, the point in time we'll get the idea, we'll be careful to public bidding. We get ICAP. We're now one of the institutions. I don't know if you know ICAP. We are associated with Columbia University. Now they win the contract. So we give them everything. Provide them do the procurement, the training, the installation, everything. So they do them, then count them.
For Connaught or
both Kenema and Connaught. And apart from the CT scan, I might say 10 ultrasound machines that also come. The ultrasound device, then I don't want to wait it. Now, like we get belly in the scan, you see Peking. Now you even see the sex of the Peking. You know if a boy Peking or a girl Peking. We get the one and say for you able to see the face of the Peking where they side the mama.
When you talk at the smile because it's quite interesting for now at this point, country like Sierra Leone, they discuss say, oh, we don't get a CT scan machine, we don't get ultrasound machine. It really they expose how empty we health sector be don't be over the years.
Well, you see, development and progress, now process. we own country, unfortunately, like other countries, we don't go through difficult times in this country. We don't go through times where really break down with whole institutions, the health sector, not be left out. Our hospitals were vandalized. There were no equipment. People left this country. So it's a process, right? So me, I don't say it bad for talker now. Wait to make it good for talker now. And for many people, they don't say it now. They can't really talk about confidence and public, for build the confidence of the public for use the facility. If the people they don't know say, we don't get an, it's okay, for don't get an, and now don't get a, why you talk? No, you get to make sure so they know say it did it now. And not only did it, the way we get it up to speed with other people them now that can, you know, buy the old one, you know, buy the now we know we do it. But you buy a very standard. If we don't get CT scans before this time, by now for the member for upgrade. And luckily now the one we don't buy, it's standard. It's the high end, so not to worry about upgrading it for the next couple of years.
You go use the CT scan.
Definitely.
You're not afraid to say let's go with the inside
No.
We will cover them live.
If I get indication for a CT scan, and I do no stand at this country past na Connaught right now. Una try make una spend time on go see this machine. And the CT scanner
go do use Mabel.
no also one after the other. The CT scan now like a round, it gets some round opening like donut, like cake. Then you debate outside the patient the down. If they go through that round place there, why they go around 90, the films they take the film. So the other sides are open. So you need to get stuck in there. If you're able to jump come on if you want. Right? A round from both ends and open. So the bed they go through, they come back. But when you go through, now they take the films and so I mean, and you get a big screen on the other side. Outside the radiologists, they observe. If anything happen, it jump in and come for the necessary things that we need.
All right, Doc, I'll just take some of the messages the way people don't send for you. So you go respond to them. This one they say, as we grapple, Usfred Kamana Facebook, they say, as we grapple with the misuse of tramadol, what are your plans to monitor this drug for misuse and introduce a controlled care management and delivery in which within the various care settings only trained and qualified nurses dispense the said drug, witnessed and documented by 3 staff? I guess you know the Pharmacy Board Act must be revisited for import and sales.
David M. Tholina, the YouTube channel, he say, great. The management training is greatly appreciated. Please note that the impact of monitoring is often undermined. Monitoring these facilities should be a key focus to access the training effectiveness.
This one say, what plans have you put in place for the closure of the MSF project in Tonkolili, Bombali, and Hanga in Kenema districts, especially in their treatment of tuberculosis resistance? Also, do you plan to recruit their health workers? Also, the facilities supported by partners in health, the Gen Expert machines, are there enough cartridges for the PCR machines? Finally, how many more PCR machines that are waiting to be installed do we have?
Albert David say, how can citizens be expected to place confidence in a health system that the nation's own leaders consistently avoid, even for the most basic medical needs, while urging the public to trust facilities they themselves refuses to use?
Are there plans to build a ramp for the surgical ward at Connaught Hospital? The stairs have been a challenge in that settings. And how are surgical consumables going to be reinfringed?
This one from Daifan Kuruma. It says, sir, the emergency hospital at Godrich, is it a government or private owned hospital? Because when this hospital started operation in the country, it was almost free of charge for emergency accidental cases and it was easy to access. But now all that is gone. It's very hard now to access, especially by locals living in this community.
Usman Kama, according to a tweet by the ministry towards the tail end of last year, CT scanners and U-scan devices were not purchased by government, but rather it's a support from the Columbia University in the US through collaboration. The question is, why is it being shifted to public-private partnership?
This one from Tijan Sila is a well, Khadija, someone has to do it and we have to start somewhere as a country. My only hope now is for us to maintain those machines and for the government to do more by building and equipping them.
Mohamed Saliu Sisse, and it will be the last one for now and come back to Dr. Kaba. He said, let's say the truth. The government didn't have confidence in the health sector. If the minister is sick, he or she will travel to overseas.
All right, if I know Mr. Gote, before we come to Dr. Kaba, Mystic Nadwazak say monitoring remains a major challenge in Sierra Leone's health sector. Many qualified doctors spend limited time in public hospitals whilst focusing more on private clinics, which negatively impacts the patient's care. I wish you success in your campaign that's at the ministry to ensure safe and efficient service delivery.
Peter Charles, he said, kudos to Dr. Kaba, DCMO Clinical, for your timely, innovative access of healthcare services to the people of Sierra Leone. Dr. Kaba?
Thank you very much. A lot of good questions, and it shows the people are really engaged this morning with us, and thought-provoking ones. Some of them are comments. I'll leave the comments out. We'll just go to the somebody talk about tramadol misuse. We a big concern, and one of the strong opiates, and we highly regularized and controlled drug, for into the hands of people that we not get anything for do with them. If we want to get them, if we go through a prescription system, through a pharmacy, and the pharmacies then go prescribe and give them. If somebody sell them illegally, I think there is a penalty for being associated with this. And they're right, the Pharmacy Board Act is something we are really considering to revitalize and get a new one. The team is really working on this currently with the Directorate of Pharmaceutical Services. Of course, management training is not the only thing. You have to back up the management training with supervision, right? That's why the management training model we'll get is like we'll not just do one-off. I'd say a 9 months process. Inside these 9 months, it will come with key supervisions the way we also conduct in terms of the performance of we managers the way they train. So therefore they supervise and monitor the activities inside this 9 months. Plans for Hanga Tonkolili in terms of tuberculosis, gene experts machine, a holistic. The MSF Tonkolili don't fully transition into a government led effort, and the tuberculosis program is being controlled at the hospital and the primary health level through support from Global Fund and other partners and we work with. So far so good. There are challenges, but we work hard to make sure there is no gap being felt. You don't see where you go around the country, people are not even grumbling about it. Then people they don't do now for a long time, they don't pull out, but the government don't take over the responsibility. Now the same thing they happen back now the hangar facility, we in a maternal and child facility, we they near Kenema, within a Kenema. MSF they pull out 2028. But before that happen, we don't begin for do a transition already. Right now, currently in a Ministry of Health staff in the workday, now we don't get the management, we link that hospital with the Kenema Hospital, so that at least it become a single unit for provide services in another area without having a gap. They ask if we need a ramp for Connaught Hospital, especially for the surgical ward. Of course, way to do is that we build by Ward 10, a ramp for stroke patients. Now we don't see them, right? Then patients will get stroke. Before this time, now wheelchair, then they put them, then they climb them up the stairs. But now we don't get a ramp. By the surgical side, we're also considering, based on the availability of space, for do something, or in the future for just get a lift. Yeah, we at least elevate the patients into that floor there. Emergency hospital, then services, as far as I'm concerned, are free. And people then they get access to, and they get a strict criteria when they follow. And now one place where they really help for support, especially patients that way to get accidents and trauma cases them. And so far, I think as a community member, just go there normal for all kinds sick. So I think that is one of the issues, because they're specialized by trauma. If you go there now with malaria or that, then no, you go to the government facility close to you so that we manage you. Why put the CT scan under PPP? For us, I think why make the government decide for do this is now for sustain them. Forget a framework around them. First of all, we manage the operations of it all and make sure say that whatever is being done around it is sustainable. You train, you build capacity, then government could take over in the future. You bring devices where when are not run before, we will challenge and say, okay, would you do? So get other people where they help on build the capacity gradually, they will now go take off. When I make the PPP model very important, first of all, for build the capacity for run this kind of sophisticated devices. Of course, monitoring, somebody mentioned about monitoring, we know it's key. And it's one of the things that will strengthen right through hospitals and we institutions. So make sure say people are doing what they're supposed to do. One key thing, people working in private, people working in public sector. This is a proper HR management system. So we try to see that we bring in electronic monitoring attendance systems into institutions where people can go log in and log out. They will get a proper accountability as to how people show up for work. And whether or not they show up for work, the necessary measures should be taken. Yeah, I think these are some of the issues we are able to jot down.
Government now continuity, but on our way at the Ministry of Health right now, also on our see the health sector by the end of President Birin tenure.
Well, once see the health sector, especially for make the public get confidence back by the health sector fully, then we then come, we then get the best experience when they get contact with we, especially in our health facilities. Starting up for the facility level, one for say health sector, we're resilient and ready for respond to pandemics and challenges that we usually can a country like we own country. One for say health sector would get highly motivated, highly trained and qualified health personnel where they provide compassionate care for people in this country.
And access now one, and also affordability.
Yes.
All the services are going to be affordable, because you speak about the CT scan earlier. Is it affordable?
Yes, the fact that now public sector hospital it get to be affordable, and there is also an arrangement around it for people that will really not get nothing, so that at least there will be some concession given to them, and an arrangement for make them get access to them devices there for make them get the right diagnosis. Yeah.
In terms of the affordability, we may barely talk about. For example, if I want to connect now, and doctor recommends say I for use the CT scan, it not go cost me a million, just like waiting I go pay in the private facility.
The cost will be different from the private sector, because first of all, government don't buy them, you don't put on there. Not to businessman buy them for making money out of them. So the cost is really trying to recover some cost, so that, like I just said, no more. If part spoil now, would I get for buy? Now the machine get for make that money. If not to that, you get for go back, go be fill pet form, go to Ministry of Finance. It will be challenging. But if you get a system that at least you collect some money, you will put it aside. If anything happen, now they will pull for repair the machine. If when I get staff they will need, when I specialize people, then I don't go to pull for pay them. If when I get running cost on the generators, the electrical solutions, Now they will pool for runners. So it's, you get forget some costs associated, but not compared to the private sector costs.
What inform the decision say the CT scans na Freetown and Kenema need more?
Well, now the assessment we do based also on the health infrastructure they will get in the country. First of all, Freetown must start there. Freetown now the teaching hospital. Cannot. You don't get a teaching hospital where you don't get high-end devices like CT scan. It help first of all the specialists that will all get now they sit down for help for making diagnose well. Then it also help for train people. You know, we'll say in a master sabi person for this particular disease, like in a surgeon specialist or radiologist, and no one they say CT scan machine. You know, they work. So, and the volume of cases then, all they get were required, and looking at the cancer cases, not the cancer patients, and they looking at the trauma, the one day where they get accidents, the head injury, not cannot then. Then you look at Kenema. Kenema, because of the strategic location at the center of the country towards the east, to the eastern part of the country, they get a very huge catchment population. Going down there to Koindu, we'd even take people then from the other side, go towards the Liberian axis, you know. So they get also this stroke unit thing at Kenema. Now the only provincial hospital we get a stroke unit.
Okay.
And you know they diagnose and treat stroke patients without a CT scan. Well, you get for know if na hemorrhagic, if na ischemic type of stroke for know the kind of treatment. Then thirdly, MSF facility were on it in a bigger facility. So if you compare both beds that we don't get in terms of bed capacity, we are talking to close to 300 beds in that Kenema region where an office will get now other hospitals them. And the more beds, the more complicated cases, the demand for high-end sophisticated diagnosis is there. So now that they inform the decision. However, this not for stop there. You know, means in Africa and Kenema, don't forget. Other side and forget, but when you do something, you have to prioritize, and society start.
All right, many thanks, Dr. Kaba, for joining me this morning. We can talk about the different upgrade them where una they do na the healthcare sector. Hopefully the next day again. Yet you know for talk about another CT scan on don't put another district because UCFC need day for not just the Kenema and Freetown. Other side they need forget the CT scan. Well, that's Dr. Mustafa Kaba, the Deputy Chief Medical Officer for the Ministry of Health. We'll continue forget the Ministry of Health from time to time for can talk about some of the things them where they happen at the health sector. Well, quickly, we come now to the other studio guest, when Dr. Richard Conte, one of the flag bearer aspirants them for the All People's Congress APC party. Over the weekend, we see Usai write an open letter to the Speaker of Parliament to say raise serious concerns about the National Security and Central Intelligence Act 2025. Well, what are some of them concerned there and the fear we get if this bill passed in Parliament? As we all know, the Chief Minister, Dr. David Senga, about 2 weeks ago, been go table on a Parliament, and this bill they now before the pre-leg committee where they look inside and take concerns from the public. Let's just take this short message from our partners. They will come back when they talk to Dr. Richard Conte.
Wise men bank with UBA.
Wise women too with UBA.
School pupils in Sierra Leone, do you have a creative writing skills? Would you love to win a brand new laptop and a scholarship grant worth up to 50,000 new leones? Then, this is your moment. The UBA Foundation, with support from UBA Sierra Leone, in collaboration with the Ministry of Basic and Senior Secondary School Education, is proudly launching the 5th edition of the 2025-2026 UBA National Essay Competition, as the UBA Sierra Leone has teamed up with the Institute for Legal Research and Advocacy for Justice, ILRAJ, to make it bigger and better. Are you a senior secondary school pupil anywhere in Sierra Leone? Then get ready to showcase your ideas. Write a handwritten essay of not more than 500 words on the topic gender-based violence in schools, causes, consequences, and solutions. And yes, the rewards are exciting. First prize, a brand new laptop plus a 50,000 new loans scholarship grant. Second prize, 30,000 new loans. And third prize, 20,000 new loans. Remember, your essay must be handwritten, not typed. Upon submission, please include your full name, passport photograph, your age, town and district, school name, and of course, the name and phone number of your parent, guardian, or teacher. Submit your essay at any UBA branch, MBSSE regional office nationwide, or the ILRAJ office, or send us a scanned copy to CFC Sarah-Leon@ubagroup.com. For more information, please call us on 078 200 200 or 099 22 11 22. Deadline for submission, April 30th, 2026. So, sharpen your pen, share your ideas, and be the voice for change.
All right, we get Dr. Richard Conte now with me in the studio, one of the flag bearer aspirants for the All People's Congress APC party. As I stated earlier, it gets concerned where he puts now a letter we write to the Speaker of Parliament. We get for do with the National Security and Central Intelligence Act 2025, a bill where the Chief Minister been go table a Parliament any day before the Legislative Committee now, and anytime from now it will come back na Parliament for first, second reading before Parliament go turn them to law. But Dr. Conte say he get concern about this particular bill. We may go get another studio this morning for can talk about some of the concern the way he outlined inside the letter where he writes to the Speaker of Parliament. Good morning, Dr. Conte.
Good morning, Khadija. Good morning, Mabel.
All right, before we can look at this letter where you write, quickly, let's just go because you know one of the people we been there from the initial stage when I get this agreement for national unity. At some point, it been get for stall, una come back na the table, una get negotiations, and this means again the most recent one away una say una they withdraw all una elected officials them, and it don't happen for almost a month now, and we see communication where the Independent Peace Commission put out say the international moral guarantee they come back, and then they start for me to tuna from tomorrow now, a long week, busy week for now. Then get for Kana on a party office, then get for me to the two chief negotiator them, and then they end up with His Excellency the President. Then we go back to Usa. All of this begin and to Usa on a day now.
Yeah, thank you very much, Khadija. This whole thing begin because then the SLPP government choose for thief the past elections in 2023 in consultation or in court with the Electoral Commission for Sierra Leone.
When you say thief, Dr. Conte, was it exactly you try for say? Because the same word on a Secretary General be used now on a mammoth meeting, and up till now it is stand trial.
I repeat, the 2023 elections were stolen because we believe, based upon the evidence we get, we say they no win on the first ballot, and we believe, say, ECSL then get a responsibility for provide the disaggregated results by station. They not provide them. ECSL go ahead for announce final results, even when the tallying process is still ongoing at the various regional tally centers. That in itself represents a serious breach to the electoral process. It undermines the credibility of the process. Plus, almost all the local and international observers then put a message for say the results as announced by the ECSL get a lot of statistical inconsistencies, and that based upon their own analysis, no party not being supposed for win on the first ballot. So if they go declare a winner in that election, we as APC they have the opinion say na a fraudulent process, and therefore we say those elections were stolen from us.
Now the problem
Maybe
start.
make I say from the people of Sierra Leone. So because of that, the APC we decide for withhold with services. Then after some time, decide for go to the negotiating table and we come up with the agreement for national unity. The expectation are that the government will act in good faith. At every stage of the process, APC don't fulfill your part of the bargain. Up till today, they not fulfill all the provisions in the agreement for national unity. Then, Pillar 3 of the agreement called for the set up of a tripartite committee. The committee come up with 80 plus recommendations. And again, on all of those recommendations, even according to their own report, after almost 2 years, they have only implemented 10% of the recommendations, according to their own report. And in the process of implementing one key recommendation where they affect the electoral process, we get for do with the appointment of the Chief Electoral Commissioner, we did not agree in the tripartite committee for say, because of the challenges involved in the appointment of electoral commissioner and because of the role where the person they play, it will find make that person they be neutral, make it not be overly partisan, make it be somebody we go day by merit, somebody we go get the confidence of the people of Sierra Leone. So we say therefore establish a search and nominating committee. We go receive applications from all and any Sierra Leonean we feel say it meets the criteria. They interview the shortlist 3 people, give that to the president, then from those 3, he can choose one. Whilst that bill being the working way through parliament, they don't do first reading, they don't do second and third reading. Of course, the APC been get their own concerns about how for appoint the members of the committee. While that process be the ongoing, we be engaged with the Office of the Attorney General for try to see how we can address those concerns. From nowhere, SLPP go back to the law where we all be don't agree say in all good law changer. The law we themselves don't agree saying for changer, they don't take a revised version to parliament, they don't go through first reading, then don't publish the revised version twice in the gazette, then go back to the trash can, go take them and can use them back for appoint a chief electoral commissioner. But what's even worse, the fact that when they come for appoint, knowing fully well that one of the challenges in the 2023 elections we get for do the one day way they be superintend the elections. And in this case, Edmond Alpha and the rest of the team, Mohamed Kone and others. I think that if they be really mean well for this country, that if we don't go outside that set, because APC was very clear, for say we don't want any of those people, we don't lose confidence in them and their ability for being neutral. So we made them change them, bring in some neutral people where go get, just like football match, even in the court of law, you need to get confidence that you will get fair play from a judge. If not, you can ask for the judge recuse himself. So we say, this policy here enough it. You will get 8 million per this country. I'm sure you can find somebody else that can meet the criteria to become chief electoral commissioner. It does not have to be this particular guy, but they insist whilst we be the try for engage in the process, then rush for go put them through parliament and swear her into office, and we say we not accept that. Plus, we don't face a lot of harassment, intimidation. They don't shrink the democratic space. They don't weaponize state institutions against the party. We know they talk again, they arrest we, detain we for various reasons, and the country, the hardship don't pass mark. Fuel prices they go up and they affect the businesses that they close, things just difficult. You go on the streets, keke riders, okada riders, transport owners, then they harass them all over the place. So things have really become unbearable for the people of this country. And so we as APC say, we cannot continue to sit idly by and allow this to continue. So we continue with withdrawal of services, and then we decide to say at some point we will protest. And now you see how instead of engaging with us, then they about the try for thief. We see how the chairman of the party, they talk say in don't bribe 4 APC councillors 100,000 each. Then an outright case of admitting involvement in bribery, where if we can get a credible anti-corruption commission, we believe say by now that for at least invite them for explain. And with all the tensions around, with all the difficulties around, with all the challenge around, we see how the president go to a village again. It make insightful statements against the party to the extent of even talking about death to members of the APC in Bont and by extension, the whole country. Those statements not helpful. And clearly, they put the PPRC in a very difficult situation. Because now it's the day between the rock and a hard place. They don't know what to do. You know, can they go after their president? Can they go after their SLPP party chairman? Can they go after their ministers who are making these statements? But all of this, they just show, say, this SLPP government not they act in good faith.
So, Dr. Conte, now some of them things here on the campus before the international moral guarantor them, we don't start this negotiation between UNA and the government?
Yes, we don't already do that. We don't put it in writing. We don't communicate that to the moral guarantors. And we don't copy the relevant government institutions, but they should be aware. So we are seriously concerned about these things, and we believe, say, in the best interest of peace in this country, the need for speedily address the concerns.
So the APC believes, say, not the only option than the way una don't be left with, but go back to the moral guarantors, for come back to the table. Now that's could be
we
a
not really
solution.
go to the moral guarantors for them to come back to the table. No, we don't decide, say, we order a nationwide protest. I think, say, when the moral guarantors they hear about this and then decide for come, not we invite them, then decide for come and can see how they can possibly try for resolve the impasse.
But the last they host on a chief negotiator now, he say one of the steps they want to take now for go back to the people them will be forced bring on at the table.
No, yeah, I mean, but I sure see what it mean now that when they call for talk to Benin, we be don't say we're not going to meet with government. But if the moral guarantors then come and then invite we for talk, of course, we go talk with them. So yes, we not they refuse for talk with them because we be don't visit all the embassies in this country for bring to their attention these concerns where we get. And so following that, they escalate the matter to the chair, to the co-chairs, when Madame Tambajang and Simao from UNOWAS. So now then they come with their technical teams and we can see how far we can go the process.
But I believe this will bring a solution because by a clear indication, one of the major things they want to ask for seems for being possible from the side of government. When I for pull Dr. Alpha and Mr. Alpha come out now, the chief electoral commissioner, that seem like government not get for do that and they wanna feel so wanna go forget a solution to that under this arrangement of moral guarantors meeting with una again.
Well, that's up to the government for decide, but me not believe say anything impossible where there's good faith. When in 1999, at the end of the Lome Peace Accord, they agree say therefore make Fode Sanko a rebel leader, chair of the committee where they oversee precious minerals and get the status of a vice president and appoint other members of the REF as ministers in the government. It was a difficult call. But it took Echijan Kaba. It took Solomon Berawa as Attorney General for make them put country above self. For make them put country above everything else and act in the best interest of peace and stability of this country. And then kind of implement them to the letter. As soon as Berawa come back, he take the document, go cabinet, then pass them, he go down in office, he draft them into an act, he take the bill, go now parliament ratify them, and then they implement them because there was a will. The will was there. in the presidency for make the right to have more get peace at this country. Another peace the world enjoys. And that is why when we see people they take deliberate steps for undermine that peace and take this country back to which side we don't come out, it's very concerning for we as APC, and we believe so for bring this to the attention of everybody.
On optimistic say the meetings there so then long meeting there so because we look at the agenda with the outs, then they meet with all the relevant party them. For the APC, and I believe say this will bring solution to this problem we don't do for over a month now.
First of all, APC not agree with the agenda they put out. And we don't we not agree with the agenda where they put out. They not consult we whether they prepare that agenda there. And if you look at that agenda, it just they downplay the issue. The real issue is about a conflict between APC and SLPP government. That is the issue need to be addressed.
But so all the people there, whether they meet with,
yes, we know. Yes, we know. But we believe, say, 1.5 hours, not a sufficient enough time for engage with the APC for let we understand the issues. And we believe, say, if these issues have to be resolved and resolved permanently, it require more time for do that. But we don't make we concerns felt, and we believe, say, the entire agenda will be revisited for allow for some constructive engagement. Whether that they will lead to a permanent solution, I don't know. But we as APC, we are open to all scenarios. We ready for engage. We ready for restate we positions, and we hope say in good faith the other side will also come in good faith to the table, and we act in the interest of Sierra Leone. This is about Sierra Leone, not about any particular party or interests.
On not been pulled date for a protest.
Yes, we not pulled date.
So after the meeting, they cancel this protest.
I don't know what you mean by cancel. We don't indicate say we go protest if we concerns are not met. We they allow time for constructive engagement for go on. And when, depending on the outcome of these engagements, we go advise ourselves on the next steps.
All right, now we come out to the letter where you write to the Speaker of Parliament, we get for do with the National Security and Central Intelligence Act 2025. You get plenty concern them where you state. The main one where you talk about are that power go dey na one money and also the president will get almost full control on the security system. Why you feel say if this bill pass na parliament, one man go get the power and he go get full control over the security system?
Now because of the antecedents, we already will get a total state capture. Now, Sierra Leone, we get a situation wherein too much power vested in one person, the presidency, and there's a whole discussion about the need for reduce the powers of the president. We don't get instances of abuse of power by people, by the presidency to be specific, and we think say doing this again would just compound the problem. You know, Khadija, while we understand, the issue about security reforms is not new. If you go back to the most comprehensive security reform that this country, it took place under Tijan Kaba. And Eskorma inherit them. And Nadande would roll out 30 day. The process for do such drastic security reforms, it got to be an inclusive process. Everybody got to own up. Sadly, the first time we hear about this, now we see a tweet from the chief minister for say the go ladies security bill in the parliament. That I think is wrong. That I think makes the whole thing suspicious. And there seems to be a pattern in the way the SLPP behave. If you look back in 1964-65, just 2 years before the 67 elections, they did the same thing. Where they bring on drastic laws, the seditious libel laws of 1965, all in an attempt to stifle the opposition all in an attempt to allow them for indiscriminately arrest members of the opposition, all in an attempt for just give them an advantage in the run-up to the 2067 elections. But what happened again, they go in, they lost. And then when after they don't lost, APC begin implement their own law, they cry power. But they don't learn. They don't come, they don't repeal that law they now, they don't introduce the the obnoxious cyber law. And now, see that's not good enough, they don't come with this one. All in an attempt for go after the APC. And in this law, if you look at point 5, where for me, one of the most worrisome, section 1, where they talk about the definition. Then they define a threat to national security very broadly. And they say any action where directed towards achieving a political objective, like a security threat. And if that they happen, even peaceful political protests, like what would they try for do so, the unions then, if the protest civil society activists like Una, they could just arrest Una and lock Una up. So the powers where they not get in the current existing laws for go after the opposition, for go after activists, and they try for bring inside this law. You know, and inside this law, there also, if you look at section 43, they not only they give themselves unnecessary powers, they also they indemnify themselves. Mm-hmm. So if, for example, for 43, the Director General can authorize undercover agents and sting operators against anyone where they believe, say, they pose a security threat. So people participating in any operations, like sometimes even some of the things that they do, they can classify as being subversive, and then they can hold them criminally responsible for that, and they can arrest you now, and they can send sting operators after you now. And the bad thing is that any act where they commit in that process is also indemnified. You cannot hold them responsible. So they can misuse these laws for trap any innocent citizens. If you look at sections 40, 41, and 42, under section 40, the Director General, all you need for doing is for go to a judge or a magistrate for make them give permission for intercept your phones, intercept your messages, intercept your emails, and go and search your home and all your devices. That is too intrusive. It pry into people and privacy. In section 42, this same person, it can request any kind of information about you without any warrant, as long as in classified and they has been serious and urgent. I think so that is a bit too an overreach. And when we get a country with a history of people abusing power, of people using their offices for go after their opponents, then we see that they give themselves this type of powers when they become suspicious. So I am saying, as a citizen of Sierra Leone, I say we need forget we own say. And I'm prepared. If they want me to make a go to parliament, make a go face them. If we APC no did it, are ready for good day.
You see?
For go face them and tell them, say, wait till they try for do so, it's dangerous for this country. And we believe, say, if they want to pass such a law, make the process for come up with those laws be inclusive, let we all buy into that. Because at the end of the day, it's about Sierra Leone. And they don't have enough power forever. So if you pass bad laws, they can come back to haunt you. I wouldn't think that is good enough for this country. So me, as a citizen of this country, as a concerned citizen, we mean well for my country, I decide for take this action, I consult with lawyers, because I'm not a lawyer. So I consult about 5 lawyers who help me for put together this document, and I don't forward them formally to the speaker. It's supposed for don't receive them because then I go to a book, they sign for them, the Attorney General don't receive them, and all the relevant people they don't receive them, they don't sign for them. So they expect, say, over the next coming days, there should be an engagement for let we try for see how we can address some of these concerns.
You think, say, if this bill goes through in a parliament as it is so currently, it will tighten the space of public expression, people and being free, rather than improving on the security, wait and see, that make it come up.
Exactly, and even the security, they already get the presidential guard. where they just at the whims and caprices of the president. Which not they fear? Why did you continue for give yourself many more powers? You see, and what's more worrisome, Mabel, are the fact that the checks and balances were supposed to exist not seem to be adequately provided for in this bill. So it's very prone to abuse, and that is the worry where we get, and when we think about how what they do in 2023, what ECSL they do, where who ask for any information say it's classified. That's the same thing they run this bill here. Any two way they do, any two way they want for say it's classified, and then go give themselves in this bill powers where they even make the FOI bill irrelevant. Because now they now go decide and they say this is classified. You cannot have it. This is classified. And at the same thing, ECSL in 2023. Any two will ask for they say classified. What determines what is classified? What are the criteria for classification? In developed countries, developed democracy, yes, they have classified documents, but there are clear steps we follow for make something classified, and there are also clear steps where they take for declassify certain documents. And there are checks and balances for avoid abuse of these provisions. But if they just make us so loose, like how it is inside this bill, without adequate checks and balances for put the government in check and for ensure that they don't abuse the people, I believe it's bad for the people of Sierra Leone. So as a citizen of this country, I think I take up on myself for bring this matter up. And like I say, if the speaker so desire for make a go before the legislative committee in a parliament or even the full house of parliament for go engage with them on this issue, and let we get a frank discussion as Sierra Leoneans on how best we can improve upon the bill, we go wrong. I'm not saying that we don't need stringent laws. I'm not saying that. We need laws. I'm not saying that we for underplay the security concerns of a country. I'm not saying that, but I'm saying because of the record, the history we got at this country, let we not vest too much powers in one person. Two, let we get checks and balances. Let we not empower institutions so that they can go after ordinary citizens and get away with them.
You not think Sierra Leone do reach to the stage where the country forgets strong surveillance systems? And how you will balance security and privacy?
That's what I'm saying. There's a fine line between security and privacy. But you for also get a responsibility for protect the individual citizen in your rights. So because if we go for no say where say your own rights stop, the other by they start to. And so if you think say because you're in a privileged position now, you pass any kind of law, it defeats you. What will happen tomorrow when they're in power? And then they will use the same laws against you. You got to be very careful. So that's why they pass laws, you get for think broadly. Think Sierra Leone. And imagine, say, if Namide in opposition, will I be comfortable with this? Will they do so? And I sure say they will not. And antecedents are there. Let's talk about 64, 65 seditious libel laws. Will they be cowed just because they want for go after APC? It will sound good at the time when they do. But then when they go and lost the elections, and APC now begin apply those very laws against them, they begin cry foul.
But again, somebody would say if government not try for control the informal security group, them that's gonna make crime increase.
No, that is just one aspect of the bill. Not in the whole bill. You see, we got for always note, SLPP then gets a pattern. Whenever then they push forward the obnoxious policies, then they put them side by side with some policies were very good, where all man go want. Definitely, for make a private security firm operate in any country, need a license. And so now government get for gear and that license day. And before you give the license, you get for meet certain criteria. So if you not meet those criteria, of course, therefore the register that company and not put it in operation. And if you decide for continue for operate, there should be consequences. I don't think say anybody gets any serious reservations or concerns about that. But the fact is that when what is good for the goose has to be good for the gander. If somebody also they apply for set up a security firm and it meets all the requirements for do so, you know, for deny them just because you get one or the other reservations about the person maybe in political affiliation or whatever, you know, it's not fair. But you also as a security company, you get a responsibility for comply. Because if you're in a security company, you therefore operate within the confines of the law. If not, we'll get a situation wherein then they scatter weapons all over the place, and that is bad. But let's say this. Now, we talk about security companies then, where in their opinion, they say, so now they comply and therefore they find their 500 million. Excellent, powerful. But where they now? We don't decide for use the powers of government for go train militias as policemen and as soldiers. Then recruit them in very clandestine ways, in less than transparent ways. Then they go train them in hundreds, if not thousands, and then they go unleash them on the people during elections. How do you describe that? I think the SLPP government. Right now, the Depa train Sojaman, the new Sojaman, the policeman.
That's a very big allegation. We
say
the SLPP government.
Not fact. The Depa train policeman there and Sojaman there right now, and some paramount chiefs they recommend people them for make them go take them. They not take them. Understand? I don't receive those complaints from a few paramount chiefs, especially from the Northwest.
Well, the normal procedure that's for a paramount chief recommend somebody we not go to, we not meet the criteria with the military or the police set.
No. The people who meet the criteria are clear. Okay, they specify the criteria in the adverts, and the paramount chiefs and they recommend people there from their chiefs, because you know there has to be a vetting process. For make somebody join the police or join the army, the issue or you need a guarantor, and I think say the paramount chiefs they're best placed. There's the people there, they control the people there, they keep best vouch for those people. But we get cases wherein I'm not going to name the paramount chiefs in question. I say, well then, many people they don't even consider one of them. And if you look at the composition behind the way they go for training, it really sad. If they take people from the southeast, that they can't record them in the system under districts in the north. It's unfortunate.
They for sure then see how we did support, Doc.
Oh yeah. It's Sierra Leone a small country. Secret not there. Anything if you say they do in private, all man they know. You just need for publish the list of the better publish the list of the people where they live and train, and you will see from the names alone you go suicide and come out. Although of course we get so many cameras and counters and jalos with the come from the other side.
Should we as a country dwell on the same narrative here where they try for push about you go no say somebody come on based on a last name?
It's unfortunate, but the reality is yes. It's unfortunate that you easily know, and wait till they make this thing don't become so serious. It's not that we will not be know which people and come out in the past because of based upon their surname. We always knew, but it never ever become an issue. It never become an issue until this time where they don't make now a crime for make you get a particular surname, for get a job, or for get promoted the police or the army, etc., etc. It has become so serious that it is now an issue. It's not supposed to be an issue, because at the bottom line is that we are all Sierra Leoneans and we all don't intermarry, we all mix up and box up, we all over this place. And so when you meet the criteria, you're supposed to forget them. But sadly, because of the way they treat people over the years, this issue, we're not supposed to be an issue, don't become an issue.
You criticize immunity for officers.
Yes.
And that's now one way, going through the letter we get to the speaker, the one that say why Dr. Conte for criticize immunity for officers where they protect lives and properties.
No. Just because you did for protect life and property, don't mean say for abuse. If you do within the confines of the law, it's not a crime.
Mm-hmm.
If you not abuse, I say, who say you don't right stop? Right? The other person you don't right self they start. So if you get an overreach and you feel say because you're in a privileged position and therefore you abuse the rights of the other person, I think say you for be held accountable. But what they do now also know that even if they abuse their powers in the discharge of their duties, they grant themselves immunity, they indemnify themselves, and that is bad.
According to you, now this particular letter, you say balance is missing. And you say security should protect the people, not make people afraid.
Exactly.
How this particular bill will also, letter will also, how the bill, they make people afraid instead of protecting them?
Make I give you the example now. The Director General, according to Section 43, that you can authorize undercover agents and sting operators against anybody who believes say they pose a security threat. So people participating in these operations cannot be held criminally responsible for what they do during those operations. It worries for me. As a citizen of this country, somebody where they advocate for which I believe in as a party. The issue about the definition of what they consider as a political, as a threat to Sierra Leone, where they classify anything we person they do towards achieving a political objective as a threat. So, like where would they plan to for demonstrate nationwide the protest? Then they could be considered a threat to Sierra Leone, and then they can justify why they can go after we and arrest we and detain we. They can go to any magistrate and go get an order for me, then tap my phone, then tap all my messages, then tap all my emails, then go into my house premises, tamper with all my gadgets, scatter, ravage my house. In the process, I could lose a number of things. I think that's an overreach. That's an overreach. And I think say, when we get a pattern of abuse, then they even without these powers, we get a pattern of abuse. Waiting will happen now with these additional powers. It could be worse. So that is very worrisome for me as a citizen, and that is very concerning, I believe, for any well-meaning Sierra Leonean. And we believe, say, we need safeguards. It needs to be balanced enough for ensure, say, myself can be protected. You know, the adequate protections are not provided for in this bill as it is. And that for me is very concerning. If
I can borrow your word, well-meaning Sierra Leonean.
Yes.
Why should the well-meaning Sierra Leonean with P20 to constantly be worried if you not say law-abiding since such bill? Why for be worried? If you know you're doing the right thing.
Like I use myself as an example. I go one time at AYB with one minister after an election, and would not be scatter finding. 2 days later, I received a call from ACC. They said that they can't have my office for car arrest me. I said, for waiting. They say I thief $11 million. They tell me be Minister of Trade 5 years earlier. Now I say, who's how they? They said they didn't have office. I said, no need for car arrest me. Maybe they can't be too now. Understand it. So I enter my motorcar, I drive, I go to the office. As I enter, they say I don't under arrest. I say, okay, no, I don't under arrest, but for waiting. They say for $11 million we are thief. When I been there as Minister of Trade. Now I say, well, I know how government they work. When I feel say because you're a minister and they don't allocate, get a grant, the money they can to the minister, you don't understand how finance they go. The minister needs to steal it to any account. With all of those things, they see me for sure in the account number. I say, first of all, me not to accountant, me not to vote controller, me not to steal into the account. I don't leave this ministry 5 years ago. I know they left the ministry with the files of the ministry. If you don't want information about this tier, when I go to the ministry, when I go to foreign affairs, or when I go to the embassy in Ghana, they say no, they detain me for 5 days, investigate me for 3 years, freeze me accounts, ban me from traveling, even for go for medical, they don't allow me, even for go visit my family, they don't allow me, subject me to all types of inhuman treatment. For nothing. Only for make after 3 years they write a letter, a report. I get the report. For say the money they in a bank of saloon, the money no loss, and that type of stuff. The money in a bank of saloon, the money no loss. That's what I told you from the one, and that they for caution me because I refuse for give their bank account. I said, look, they are ridiculous. I mean, accountant general for giving a bank account. So you see, it is this type of abuses of the rights of a Sierra Leonean we are concerned about. They don't get any reason for before arrest me and detain me. Yes, you can invite me. Yes, you can question me. And because of the status we are attained at this country, you for grant me bail on my own personal status.
So, Dr. Conte,
so if I don't suffer this before, say once beaten, twice shy. So if I see laws again, where they give them more powers, more freedom, more liberty for do these types of things, a bit more intrusive even into my privacy as a citizen, I think say it's concerning enough for me for raise the alarm.
This bill still in a parliament.
Yes.
It is at the pre-legislative committee.
Yes.
And now you don't write to the Speaker of Parliament,
Yes.
highlighting all of them concerned that we don't discuss.
Yes.
If them for amend this bill, which particular area you think say them for amend?
I state all the relevant sections we get concerned with, and I talk about the necessary safeguards which they're supposed for bring in. I believe say that is part of waiting the consultations will ensure. I believe say in the process of doing the consultations, we will get a copy of the bill itself. We will look at these provisions. And I believe say we will then take the appropriate action and make necessary adjustments. I'm not saying the bill will be thrown out, no. But I think say the necessary safeguards have to be put in place for ensure say the rights of the citizens are also protected. And we say the citizen feel say they don't encroach upon their own rights and liberties as a citizen, make it also get an opportunity for seek redress.
You say for give the chief them more power and risk. And also you talk about some of the things them we just don't mention about abuse and also control, even information the way we suppose forget it go reach to a time it will be more difficult. And the last time, like I say, we talked to the member of parliament now the chair of the pre-legislative committee, because not so you want no more reason concern there where the bill be just go before parliament. A lot of people have been concerned about some of these same things them where you they talk about. So you don't try for engage before this letter, you don't try for engage the pre-legislative committee for highlight some of them things there before you escalate her up to the speaker.
No, I don't escalate. That the correct line of action where they take. When you inform, you write to the speaker go now minute to the relevant committees, and then it go initiate the necessary line of action. I believe saying that the right approach than the way for take. And then you ask the issue about the paramount chiefs. You see, like I say, the whole problem now the pattern we don't exist, and the concern two people get about overreach. There's nothing wrong. You see, we get for separate traditional administration from government administration, local governance. Traditional local governance, we go for separator. But that is the spirit behind government of this country. If you read what I say, in communities where paramount chiefs are politically partisan or abusive, so it's not in all communities. I say this gives additional coercive power to that paramount chief over ordinary community members, backed by the full weight of the national security law. You know, so it's prone to abuse. If a situation wherein we get people that way civil, I mean, like in America, for example, where one officer feel say this line of action where they ask me for take and not they take them, it is state as I know they do. Understand it? If them one for force for do it can resign and go back and live in life. We don't see we say they don't instruct some district attorney there for charge particular people. They say no, I need to charge them because people they get conscience, people they get integrity. But we there in a country wherein we get people in authority when they tell them say jump, you know they ask why for jump, they say how high. Understand it? And so because people then prone to abuse in this country, we get for tread cautiously. You know, they say just go take any law now any country where the institutions are well established, the structures are placed. We will not get those institutions in this country. I should say that this be make way pakaba, they be the do the security reforms, they make them gradual. Then do waiting, then no say we can able implement with checks and balances and how for go about it. It deliberate. You know, these things when people go on use AI, then just go download whatever they get for download, then can the editor adapt to Sierra Leone, then can presenter. It very scary. Very scary. And now,
is that the case with this one?
Yes. You know, we may worry now the abuse of these provisions. And we have a pattern of abuse in this country. And until that one is adequately addressed, I'm afraid laws like this will just make matters worse for the opposition. And today it is APC crying foul. Tomorrow it can be any other person. But in governance now about continuity, regardless of which party they're in power. So therefore, when we are in a position where we make laws, we get to make sure we make such laws that anybody will get for apply those laws, it will apply within limits, and it will ensure say in the process of dispensing justice, it not encroach upon the freedoms and liberties of other people. I think that is a basic right where we forget as citizens. We own privacy, we own space. But if this law, they can't allow the government for also get right for privacy with impunity. And they say in the discharge of those duties, they are indemnified. They cannot be held criminally liable. And I don't think say good for we as citizens.
You'd expect government or parliament for engage you?
Yes. I'd expect that under normal circumstances, yes.
What if they not engage you?
That they're right. Me, opposition wouldn't for talk. Understand it. I don't make my concerns them public, so it don't become now an issue for. I should say you, not to me send out to you. The social media is here. You don't call me, don't give me this chance for can't talk. I believe say other people also go see them and they go reach their own conclusions about them. But this is my own concerns we get as a citizen, and I feel say they in place to make bring that to the attention of others and the relevant authorities. Where if they want, keep do something about them.
This building on a committee stage, it might come up at any time based on parliamentary schedule. We make a lot of people say, "Ona forbidden stay in a parliament for add on a voice." Na building like this one, I believe say in all right for the country. What if this bill come on another in a parliament for challenge some of these grey areas? Will you believe say no for the bill?
First of all, before this bill they go to parliament, they be supposed for them get a consultative process. Wait for them be broad-based, wait for them allow Sierra Leoneans to make their own input, because the law is not about them, it's about all of us. So that was another one. So then they alone, they make the whole thing suspicious. Too long, don't forget, say, SLPP, except where they require a 2/3 majority of members of parliament, we did not get at the moment. If they want for pass any law, whether we did it or not, they pass it. If a simple majority, they need. And even where they need 2/3 majority sometimes, on the third vote, it's a simple majority. when they fail, forget like 2 consecutive times. So for some laws, on the third vote, they pass them. Some acts they pass them. So then get the powers for drive, whether we did it or not. That's not the point. Wetin made a call for now that not to the process for approve, the process for prepare the bill. And I believe say the process for be inclusive and the process for be consultative and therefore allow we citizens an opportunity to make an input, because it's about us. It's not just about the politicians. It's about Sierra Leoneans, because the law not they affect only the politicians, but it affects even the non-politicians. And so because of that, I believe say everybody will get an opportunity for getting say, for making your input into that law.
Earlier, you say una you work as oppositioner for talk. How you go assure the public say putting together some of them concern there, you take off your opposition lens and talk from a patriotic point of view as a Sierra Leonean, not to for just bring out points them we go fit in your narrative we want for push fear on our supporters them about the bill.
Well, I think say you don't really do present this issue now. It clear say it is non-partisan. I'm not talking anything about APC. Yeah, about Sierra Leoneans. How this law they affect we as Sierra Leoneans. When I say it affect opposition, we have 16 opposition parties in this country. So it's not just about APC. So when I talk now, I know they talk as a politician. I talk as Richard Conte, a Sierra Leonean. And I believe say this is concerning for we. And at the last page, I gave a summary for if you're not able to read everything. Okay? As I say, you say, if you read the summary side by side with the bill, you go see exactly within the concerns where I get. Somebody can choose for get a different opinion. These are legal issues, and you get a right to your opinion. But these are my own concerns, and I believe say a number of people will share these concerns. And I'd expect say the Speaker of Parliament will at least give Sierra Leoneans an opportunity, including me, an opportunity for go express we views. As I say, I'm ready for go to Parliament, for go engage constructively. As a Sierra Leonean, I will go there if them provide the necessary explanations, provide necessary safeguards, and are convinced, fine. If I'm not convinced, they still can go ahead and do what they want for do, but I will still do what they within my powers for doing for talk. I will continue for talk. You know, will stop them for doing what they want for do, but at least it will make, at least satisfy myself, say, I'll not be keep quiet. Because for that, I know tomorrow, maybe Pikin ask me, maybe Grandpa ask me, Papa, who say you been there? Who's not be the way until they happen not talk? I will say, me Pikin, me Grand Pikin, I've been right. I've been raised these concerns. I've been do A, I've been do B, I've been do C. And my conscience go be satisfied with himself.
Alright, many thanks we come to the studio this morning, Dr. Richard Conte, for can express your concern we get and the open letter we don't send to the Speaker of Parliament. We got to monitor the situation. Maybe they might call you for go discuss your concerns and we get. Thank you, we can at the studio this morning.
Thank you very much, baby. I always glad for come and I look forward to make we all as Sierra Leoneans always they engage with government, not for just oppose, but get an opportunity for how we engage. And I think this is an opportunity I don't create for engagement, and we'll continue. But we do the same for the cyber law. I've been raised my concerns, I share them with with my party people, and tell them what they did it, and they raise them with the government, and government change, then make some amendments. So this time, I only take this step because we're not in a parliament. If we're in a parliament, I've just raised these concerns to my own leader in the parliament, but because they're not dynamic, I take and direct. But I believe, say, we will continue for work together in the best interest of Sierra Leone.
All right, Dr. Conte, thank you very much. For now, the end this edition of the Breakfast Show. Many thanks to all who don't tune in and continue for tuning to Liberty TV throughout the day as we get very educative content them all they produce for as a public interest media. Many thanks to Musa Sao, Koma, Michael Ayeno Conte, and the rest of the team will support the production team for bringing this edition come to Una. Mina Khadija Bangura, they say have a good day.
Right, well, till we meet again, Mabel Kabadi, get a good week and goodbye.
Building tomorrow today with Rightmove. Looking for quality, reliability, and innovation in your next big build? Choose Rightmove Engineering and Construction, Sierra Leone's trusted name in transforming ideas into enduring structures. We don't just build projects, we craft landmarks that stand the test of time. From state-of-the-art offices and modern homes to fuel stations, water systems, and infrastructure, our team delivers precision, passion, and perfection. At Rightmove, we are not following industry standards, we are setting them. Through cutting-edge technology, uncompromising safety, and sustainable solutions, we are building a brighter, stronger, and safer Sierra Leone. Visit us at 54 Campbell Street, Freetown, or call 078399475 or 077504338. Rightmove Engineering and Construction. Building quality, building trust, building the future.
It's Labor Day. After all the grind, stress, and queries at the office, it's time to ease your brain, laugh out loud, and feel like the CEO. Live with Kido and my hustle will make sense on Labor Day, Friday, May 1st, 2026. Venue, prestigious Pintumani Hotel, 7 p.m. Ticket prices: Kido, 500 millions. Answer, 1,000 millions. Amin, table for 4, 10,000 millions. Adil, table for 8, 20,000 millions. You don't buy yourself plenty. Now come and laugh. No excuse. Media partner Liberty Online TV and cooked by Eminence Africa.
I say it don't make sense. I don't make sense.
Wise men bank with UBA.
Wise women too with UBA.
School pupils in Sierra Leone, do you have a creative writing skills? Would you love to win a brand new laptop and a scholarship grant worth up to 50,000 new leones? then this is your moment. The UBA Foundation, with support from UBA Sierra Leone, in collaboration with the Ministry of Basic and Senior Secondary School Education, is proudly launching the 5th edition of the 2025-2026 UBA National Essay Competition, as the UBA Sierra Leone has teamed up with the Institute for Legal Research and Advocacy for Justice, ILRAJ, to make it bigger and better. Are you a senior secondary school pupil anywhere in Sierra Leone? Then get ready to showcase your ideas. Write a handwritten essay of not more than 500 words on the topic gender-based violence in schools, causes, consequences, and solutions. And yes, the rewards are exciting. First prize, a brand new laptop plus a 50,000 New Leons scholarship grant. Second prize, 30,000 New Leons. And third prize, 20,000 New Leons. Remember, your essay must be handwritten, not typed. Upon submission, please include your full name, passport photograph, your age, town and district, school name, and of course, the name and phone number of your parent, guardian, or teacher. Submit your essay at any UBA branch, MBSSE regional office nationwide, or the ILRAJ office, or send us a scanned copy to cfc-sierra-leone@ubagroup.com. For more information, please call us on 078 200 200 or 099 22 11 22. Deadline for submission, April 30th, 2026. So, sharpen your pen, share your ideas, and be the voice for change. Visual impaired students are also encouraged to apply. The UBA Foundation National Essay Competition, unlocking young talent and shaping the leaders of tomorrow. Write it, submit it, win it.
Freetown City Council public notice enforcement of frontage cleanliness. The Freetown City Council FCC has observed with serious concern that many owners and occupiers of buildings within the municipality of Freetown continue to neglect the cleaning and maintenance of their frontages, premises, and private drainage systems. In several instances where cleaning is attempted, waste is left piled near drainages, creating an unsightly, unhealthy, and environmentally hazardous condition. Part 3 of the Freetown City Council Solid Liquid Waste and Collection Bylaws 2024, Clause 8, subsection 1A clearly states, an owner or occupier shall maintain and keep clean his frontage, premises, and private drainage systems. Clause 8, subsection 2 further provides that an owner or occupier who contravenes sub-relegations 1 commits an offense and is liable on conviction to a fine not exceeding 5,000 New Leons, or to imprisonment for not exceeding 6 months, or to both fine or imprisonment. The Freetown City Council hereby informs the public that full enforcement of the city bylaws has commenced. The FCC Metropolitan Police have been deployed across the municipality to monitor compliance, conduct routine patrols, and document violations. Any individual, business, or institution found contravening the above provisions will face immediate penalties, including fines not exceeding 5,000 New Leons, imprisonment for a term not exceeding 6 months, or both fine and imprisonment as provided by law. A clean city is not only a legal obligation, it is a shared responsibility. When residents fail to maintain their frontages or misuse public spaces, the entire city suffers the consequences. FCC therefore urges all residents, businesses, and institutions to cooperate fully and maintain their surroundings. A clean city begins with you. Maintain your frontage, dispose your waste properly, respect public spaces, and obey the law.
Salon and 65. Please, Salone people, Salone they turn 65 years after independence, and the celebration is hitting the plate. So, me people, make we join the Ministry of Tourism and Cultural Affairs, the National Tourist Board, the Monuments and Relics Commission, and the Tourism and Hospitality Private Sector as we celebrate Sierra Leone at 65. The journey through gastronomy, culture, and creativity. Mark the date from the 25th of April to the 26th of April 2026. We dey take over Jijibonta car park from 11 o'clock in the morning till the next day, because we'll forget display of different kind of art and culture. Come one, come all. Come and celebrate our local heritage. Experience live cooking with unique signature dishes. Enjoy food tasting competition and plenty other things but culinaries. Art and culture, sculpture, painting, designs, comedy, artistic performance, and plenty more. After the cultural performances, you don't forget kites flying. Therefore, do the painting right in front of you. Car racing, exhibition, and plenty other activities there. With a call on every Sierra Leonean can be part of the celebration. The best part, entrance is free from the 25th of April to the 26th of April 2026. With a takeover Jijibonta car park. See you there.
You are watching Liberty Breakfast Show on Liberty Online TV.